Good morning, dear friends. Myself, Dr. Abhijit Savle, consultant orthopedic surgeon at Currae Speciality Hospital, Kapur Baudi, is going to speak today a very important point and topic is the knee pain after the total knee replacement surgery. Most of the patient, they are quite aware that because of age, because of trauma, because of advanced comorbid medical condition, usually in their lifestyle, they have a knee pain before the surgery, and that's why whenever they go to the orthopedic surgeon, once they get diagnosed as osteoarthritis, they get operated for a knee replacement. But now the concern arises is that even after the surgery, most of the patient, they are not satisfied with their knee replacement surgery. So one of the important factor for unsatisfaction is a knee pain. So today we are going to discuss why the patient even complain knee pain after a successful total knee replacement surgery at a very good center. So the periprosthetic joint infection is one of the most disastrous thing in any knee or hip replacement arthroplasty. So this periprosthetic joint infection means after the surgery few days are absolutely fine, and then patient notice that there is an increased amount of pain, swelling, a discharging wound with constant episodes of bleeding, inability to stand, walk, fever, chills, rigors, and not satisfied with his knee replacement surgery. So usually all these symptoms contributes to the periprosthetic joint infection. These periprosthetic joint infections have been classified into three types. One is an acute periprosthetic joint infection, second is a subacute periprosthetic, and third is a chronic. Acute means after the surgery, if within 6 weeks patient starts complaining of all these above symptoms like pain, swelling, discharging wound, fever, chills, that is known as acute episode. That means within 0 to 6 weeks. This time period is a very crucial and important for patient and as well as surgeon's perspective, because once the pain and all these symptoms starts, surgeon is always quite aware of that there is a chances of periprosthetic joint infection that might be occurred because of autoimmune disease, immunocompromised state, faulty surgical procedures, patient might have developed urinary tract infection, and all these things contribute to the acute infection. So the most important thing is a vigilance in periprosthetic joint infection. Once there is any doubt for signs and symptoms of infection, your treating doctor, we usually proceed with a blood parameter investigation. These are the CBC, ESR, CRP. CBC will show that there is a leukocyte count increase, that is known as leukocytosis. ESR and CRP might get raised. If there is any doubt, then usually surgeons advise for leukocyte esterase stage, serum procalcitonin level, and if any little or more doubt that the knee or hip is got infected, then surgeon don't be hesitate to take aspiration under a sterile precaution in through the knee joint. So whatever the fluid is get collected through the knee or hip joint, we send it for a culture and sensitivity. And if suppose that culture and sensitivity report shows that there is a increased leukocyte count, polymorph count is been increased, any bacterial or other infections, then the most important thing is early intervention. In such a cases, within 6 weeks, we reopen the joint, we give a thorough lavage, we do a proper debridement, synovectomy, and we do a most important thing, that is a dire procedure, is a exchange of polyethylene. So once this procedure is get over, then patient might need some 3 to 4 weeks of IV antibiotics, either intravenous or oral, and the knee pain gets settled down. Usually in some patients, the knee patient become absolutely fine after surgery, and after 3 to 4 months, patient notice that there is again the knee pain is started. So your treating surgeon, we usually exclude other reasons of knee pain, that whether there is a component malpositioning while during surgery, whether there is a patient has a muscular wasting, and the most important again, as I discussed, is a periprosthetic joint infection. If the patient come after 3 to 6 months, again the vigilance with proper clinical examination with the blood investigations, and if needed aspiration is important. If all these blood reports like leukocyte count, polymorph, ESR, CRP, procalcitonin, aspiration, if comes positive, then there are two important stages in such a knee pain, that is two-stage surgery. Usually stage 1 is the most important thing, is a removal of implant, thorough debridement, thorough synovectomy, knee lavage and proper wound lavage, and after that we usually during the same setting we put a antibiotic cement spacer to maintain the knee in extension, to keep the ligament tight, and the same time a local high dose of antibiotics which completely destroy or which completely kills the local infection. And after 6 weeks, again if the all blood parameter comes normal, we usually proceed for a second stage knee replacement or second stage hip replacement. This is the most important. Some of the time, even after the surgery, after 6 months, 8 months, patient is not happy with his knee replacement. Then the other points should get properly evaluated, like whether the patient has a knee problem. Along with knee problem there is a spine issue, whether most of the patient they have a lumbar canal stenosis, slip disc, so all these things contribute for a radiculopathy. The other issue is again component malpositioning, late infection, which is again periprosthetic joint infection. The same things, that is two-stage revision procedures are very crucial for such a patient. In current scenario, if the patient is compromised, patient is not medically fit and the infection count is not so high, we can do the surgery at one stage, that is a complete thorough debridement, synovectomy, wound lavage, and at the same time we can do a reimplantation with proper antibiotic cement, stimulant and everything. So friends, always be aware that if there is a persistent knee pain and rest of the other symptoms are also there with you, like swelling, increased amount of pain suddenly, fever, chills, rigor, local rise of temperature, redness of your skin, these symptoms and clinical examination should proceed and to diagnose it as properly periprosthetic joint infection. So myself, Dr. Savle, like to tell you that never ignore your knee pain after the surgery. So if any doubt, kindly consult your treating doctor, or you can come to Currae Speciality Hospital. Myself, Dr. Savle, I am an expert in knee replacement, hip replacement surgery. So you can take appointment at any time and I will be at your doorstep. Thank you, sir.